Okay.
Good afternoon. My name is Sakina Miles, and my topic today I'll be talking about in my speech is the advantages of vaccinations in children. I take this topic very seriously. Not only am I a nurse that worked many years in infectious disease and infection control, but I also am a mom of a 2.5-year-old little boy. So me and him both had to go through the process of being vaccinated, and all children should be vaccinated. Vaccines are safe and they prevent many unnecessary deaths caused by children in many childhood diseases. Prior to many contradictory statements, many people do choose to have their children vaccinated, and this information can be found on childrensdefense.org. My slideshow will give you a brief history. I would like to talk first about many diseases that were eradicated by the use of vaccines. There are over 14 different diseases that are eradicated in the United States alone by the use of vaccines. Right now, I'll give you the top 3. Many people don't even think about these diseases because we no longer see them. But even things as the common flu is also one of the diseases that can be prevented by a vaccination. One of the top 3 diseases I would like to talk about is polio. Polio is caused by the polio virus. It invades the brain and the spinal cord, causing paralysis and even death. Doctors recommend 4 doses of the polio vaccine between the ages of 1 month to 6 years of age. It's very deadly and is a very serious infectious disease. Polio was eradicated in the United States, even though it does affect many third world or underdeveloped countries till this day. Tetanus. Now, I know everyone has heard of tetanus. It's something that is very common and it has not been eradicated in the United States, but it can be well managed by the use of vaccinations. They are often caused by scratches or sticks or any type of metal. They cause severe pain and muscle spasms, often called lockjaw. And this also can be fatal. Remember, your muscle is a heart. Your heart is a muscle as well. It is recommended 5 different doses of the vaccine between the ages of 1 month and 6 years of age. And we often get this vaccination with the Tdap that many children get. And they protect us against tetanus, diphtheria, and also pertussis, which is the whooping cough. And last but not least, of the most common diseases that vaccinations can prevent is the flu or influenza. The CDC estimates that since 2010, flu-related hospitalizations in children under the age of 5 are 7,000 to 26,000 yearly. It causes severe respiratory congestion. Everyone over the age of 6 months should be vaccinated yearly, and it does cause death. Oftentimes, when children or even older adults are not vaccinated, they do go into respiratory distress and end up on ventilators, and it's often hard to get a patient off a ventilator once they are on. Prognosis for a patient on a ventilator is 50% rate of death once they are on over a week. And you can find this information on the cdc.org website. Another disease that I wouldn't say for a child to only be vaccinated against is the rubella, which is the German measles. I myself had to be vaccinated because my titers were low when I was pregnant. It helps to prevent the spread of rubella to the unborn fetus. Rubella can cause blindness and even fetal death. So just because you're a child doesn't mean that you're the only one that should be vaccinated. Pregnant women are vaccinated. Older people are vaccinated. Another disease that was eradicated was the smallpox. The last major outbreak of smallpox in the United States was in 1949. As of 1980, there have been no cases of smallpox in the United States. And you can find this information on the US Department of Health.org. Smallpox is a leading cause of birth defects in other developed countries. What is community immunity and how does it protect us? Germs, and you can find this information on vaccines.gov. What is community immunity or herd immunity? Germs can travel quickly through a community and make a lot of people sick. If enough people get sick, it can lead to an outbreak. And we're seeing that right now with our COVID-19. Most people are being infected and can cross-contaminating each other. So herd community, even though we have no recent tests for COVID-19 and we're still working on a vaccine, we can think about it with the influenza or even H1N1, what we just went through recently. It can lead to an outbreak, but when enough people are vaccinated against the certain disease, the germ can't travel as easily from one person to another. The entire community is less likely to get the disease. That means that people who can't get vaccinated will have protection from getting sick because there are less people getting the virus, so less people will get sick. Eventually, the disease becomes rare and sometimes it's totally wiped out. Hopefully, we can figure out a way to have vaccines for COVID-19. It's killing people at an alarming rate, and there's really not too much we know about it. They are working on a vaccine. My hospital I work to is actually working on the vaccine, and hopefully we'll have some updates. We do find that people have antibodies after exposure to COVID-19, so hopefully we can use these antibodies to give vaccines to children. Community immunity helps against all disease in all people. Often we do not think about people that are immunocompromised, people that are diabetic, HIV, autoimmune disease, the elderly. They have weakened immune systems. And vaccinating maybe a younger child or even when an older person gets the pneumonia vaccine helps to protect them, because if they do receive the disease, they may not likely be able to overcome or beat it. And you can find this information also on vaccine.gov. There are many common myths about vaccines. Autism and vaccines has been a very big reason a lot of people do not get their children vaccines. They often think that autism and vaccines, autism is caused by vaccines. Information can be found also on the CDC.com, also the World Health Organization, WHO.org. There is no link between vaccinations and the increased risk of autism or autism spectrum disorder. In 2011, the Institute of Medicine reported 8 vaccines given to children and adults and found out, except for rare exceptions, the vaccines were considered safe. Often people confuse the fact that autism does show signs at the same age as when children are getting vaccines. Most children receive their vaccines between the ages of 1 month to 6 years old. Often, most people diagnosed with autism or autism spectrum disorder are between these ages as well. So some people think that there is a correlation, but there isn't any testable proof that vaccines cause autism. And there are still ongoing trials being tested daily and yearly, and there's still no connection. Another myth that people have about vaccines is what's put in the vaccine. There is a thimerosal, which is a preventable contamination drug. It helps to preserve medications, especially in multi-vial vaccinations, as for instance, influenza. This means that there's usually a vial that can be used many times. So to prevent contamination of the vaccine, they do put thimerosal in there. It is mercury based. You can ask your doctor for a non-mercury based vaccine. Also, many vaccines could contain eggs. You can ask your doctor for a egg containing, if you are allergic to eggs, vaccination. Also, many people often think you have to get all your vaccinations at once. I know my doctor, I had questions about vaccines, and I per se didn't want all my vaccines to be given at the same time. He was more than able to spread out the vaccines for me. The best way to have any questions answered about vaccines, talk to your pediatrician. Go online, look up the information on the cdc.gov, Who's Health, but vaccines are good for your child. In conclusion, vaccinations are a necessary part of a child's health development. Without vaccines, your child is at risk for being exposed to many potentially fatal illnesses. Not only does it affect the individual, but it can also affect an entire family. As mentioned before, diseases such as rubella can affect the fetus of an unborn child and cause serious birth defects. In early years, smallpox also caused paralysis in children and adults. Vaccinations are safe and effective. Living healthy and productive lives is the ultimate goal. Protecting us and our children are our ultimate goal. And this is what we need to do is education to spread health and wellness. Thank you.